Okay, unfortunately, many older adults face chronic health conditions that require the use of several different medications. We define this as polypharmacy, so taking several medications together, usually greater than 5, but not always. Polypharmacy can happen when a patient has multiple prescribers or doctors that they see, and they're all prescribing different medications, and maybe there isn't much communication between prescribers, or maybe there is, but a drug list gets overlooked, or maybe the prescriber is doing what he or she thinks is best for treatment. But either way, when a patient's taking multiple drugs together, there can be medication interactions. So everything from sedation, depression, confusion, loss of balance, which of course can lead to falls, and even death. And on top of that, in the older population, they generally have decreased absorption and excretion from their bodies because they're just slowing down. So this adds another factor and concern for someone who's taking many drugs at once. So because this is such a problem in the elderly population, the Beers criteria was created. This is a list of drugs that should be used with extreme caution in the elderly population. A prescriber must weigh the benefits versus the risk when prescribing these medications. Some examples of medications on this list are muscle relaxers, certain anticholinergic drugs, Demerol, estrogen pills and patches, antipsychotics, unless they're being used for psychosis, and even some over-the-counter drugs such as antihistamines and over-the-counter sleep drugs like Tylenol PM. So the Beers list also gives rationale as to why the drugs are on the list. So again, the prescribers can weigh the risks of using these drugs. So as I was learning about polypharmacy and the Beers criteria, the first real thing that came to my mind was, wow, I wonder how much research we have looking at like somebody taking 5, 6, 10 drugs at once and what the effect is of the combination. And I would say we don't have a lot of real specific research with certain drugs together. And it's really kind of a guessing game as to what's going to happen when we start putting all these drugs together. So this really makes me concerned, I guess, when a prescriber adds on another drug to a patient's already long list of drugs. So as a nurse, I'll definitely encourage patients to report any adverse effects from these combinations, and I will certainly keep an eye out for anything that could be related to drug interactions. I think it's important to stress to patients that things like fatigue or loss of balance may not necessarily be related to just getting older or even minor symptoms that should be reported. Another thing that I really took from this information is to really be an advocate for patients that are on different drugs. Patients might not always realize the serious effects that can happen from combining many drugs at once, and especially elderly patients that might have a lot of trust in their doctors. Maybe pointing out a potentially dangerous combination of a drug or a drug that's on the Beers list might open a doctor's eyes to make some changes. I also think it's important to look for medications that aren't needed anymore or prescribed for something really minor. I guess what really comes to mind is kind of the new guidelines that just came out related to aspirin, and it's used in elderly patients that really don't have any history of heart disease. So it's not necessarily needed, and it's just something kind of preventative, but maybe it's something we can take away if the patient does have a long list of drugs to kind of prevent some more drug interactions. So overall, I definitely have a greater respect and understanding of, I guess, some of the cocktails we prescribe patients, and I really understand that caution needs to be taken with these drugs.